Nice to meet you all. So my name's Dal. I work for NHS 111. My job is patient and stakeholder engagement. It's very long-winded title, but the main crux of what I try and do is I come out to groups and I want people to better understand what NHS 111 is. I think in principle, everyone's heard of it, but I've been in this role for about 2 years now. My background is actually working in carers charities, funnily enough, so this is quite a double hander for me. But I've been in this role 2 years and I didn't know half of this stuff. So there's no way you guys are going to know it, and there's no way other people are going to know it if they've got any other kind of issues accessing information, whether that's language, whether it's learning disability, whatever it might be. So my goal really is to just let you know about everything 111 can offer. I'm not saying use it. I'm not saying it's brilliant. I'm not saying it's bad. I'm just saying it's there and it's another option other than going to A&E or if you can't get hold of your GP. Yeah. So feel free to ask me questions as we go along, or we can ask them at the end, whatever you like. Most of the stuff, hopefully, I'll just cover by natural course as we go along. So the basics is very simple. How do you get to us? So there were 3 ways to get to us. The most common is 111 as a telephone number. So the service is a free service. It's open all year round, all day long. We never, ever close. So the best ways to get to us are either by telephone, so that can be from a UK landline or a UK mobile. And the number is obviously 111. It's a completely free call. There's no cost to the caller at all. The other 2 ways to get to us are through the NHS app or through the website, which is nhs.111.co.uk. Any way you get to us, you will get the exact same service. So if you send it online, it will come up on one of the call handler service and they will call you back or they will interact with you online, depending on how you want to do it. So any way you get to us is absolutely fine. You'll get the exact same level of service. The 2 slight benefits I often talk about by using the online tools are that you can do it at your own time. So you can put stuff in the chat, you can go away, you can come back, you can add stuff. It doesn't have to be a pressured, it's not a time sensitive piece of work. Whereas when you're on a call, you need to be on that call. You can't dip in and out of things. You need to be there to ask and answer questions as we go. The other benefit of doing things online is if English is not your first language or you're not very good at English, whatever it might be, you can use the translation features straight away online. So that can make it easier for you if you're by yourself and you don't know how to communicate, you haven't got anyone to help you communicate, whatever it might be. But in terms of accessing us, you'll get the exact same level of support. If you are English as a second language, if you need help with English, whatever it may be, you're not comfortable, whatever it may be, we have full-on translation services. So if you need that service, the first thing you need to do when you get on that call is say that phrase, interpreter, please, and let us know what interpretation you need. We work with Language Line, which you might have heard of. So they're a big national that do all of this for a lot of providers. They have over 240 languages. So the only thing with a English as a second language call or a translated call is that it will be a longer call, because that will then be a 3-way conversation, yourself, the NHS call person, and the translator. So just be mindful of your time in that particular environment. But we can support all those calls. And at the last line, that we also talk about stuff like if you've got access with British Sign Language, if you have sensory impairment. So all of that is on there as well. Okay, so when to call 111. So this is a big distinction. This is something I try to get clear, and it's something I get asked all the time. So my main rule with anything to do with 111 is, and I'm going to say this over and over and over, if you're not sure, just call us and we can work it out. The distinction between 111 and 999 is 111 is stuff that you would go to your GP for. It's what we call urgent care. If you need an ambulance, if you need to go to A&E, if you're unconscious, if there is profuse amount of blood pouring out of you, if you've broken a bone, anything of that nature, that is still 999. So that is still an ambulance, that is still conveyance to accident and emergency. If you call 111 and you're not sure, within the first few minutes of talking to you, if not less, we will ascertain how urgent that situation is. If we feel that, hang on a minute, this is not urgent care, this is emergency care, you need to be at a hospital or you need to be in an ambulance, we will say, hang up and call them, or we can liaise with the ambulance service ourselves and arrange for them to pick you up and convey you to an hospital. So if you're not sure, just call us. But the general rule of thumb is stuff that you would go to your GP for is stuff that you would go to 111 for. And the main time people come to 111 is when they're not sure, is when their GP is closed, so evenings and weekends, or, which is sadly more and more the case, when their GP is too busy. So we've all been there, you know, you wake up, you call the GP surgery 9:05, all the appointments are gone. Those are the times when you can call 111. So where you're almost additional replacement GP type service, but we do have access to other parts of the health infrastructure that a GP probably wouldn't have. But like I said, if you're not sure, just call us and we can tell you yes or no. Okay, so I've got 2 slides on this now. This is all the stuff that people probably don't know about 111. So this is the stuff I really try and bring home to people. So the first stuff we've kind of covered, it's telephone assessment. So we will look at your needs and we will either support you ourselves, or we will send you to a service that will support you, or we can give you advice to help you manage at home. So just as a reminder, it's 24/7, it's all day, every day, we never ever close. Pop quiz, what is our busiest day of the year?
Christmas.
Close.
New Year's.
New Year. And the reason for that is the obvious reason that you would imagine it for. Pretty much it. Pretty much it. So this is a really useful part, and this is really good, particularly I find for family carers, or you know, whatever, unpaid carers, whatever term we're using nowadays. Home visiting service. So in the evenings and the weekends, so basically when your GP is closed, we have something called a GP home visiting service. So that is from 6 o'clock in the evenings till 8 a.m. the following morning. And the weekend is the entirety. So it's Friday 6 a.m. till Monday 8 a.m. So when you call 111, we will ask you all the normal stuff. We will ask you lots of questions about yourself, you know, your health, your age, your demographics, all that kind of stuff. If we, through that process of triaging you, we decide that actually, I know it's Friday night, but you actually need to see a GP today. You're not sick enough that you need to go to see a hospital. You're not sick enough that we want you to go wait for 8 hours in A&E, but we've decided through talking to you that you need to see a GP today. In that instance, we can send one of our GPs to your home. So that's not your regular GP. That is one of our NHS 111 GPs. So in Southwest London, we have 7 GP cars working overnight, and they're all dispatched from our base in Putney. So they can come and see you at home, and they come with a big medication cassette. So once they've treated you, they can also dispense medication to you. That won't be long-term medication. That will just be a small amount of medication to kind of get you through the evening or get you through the weekend before you can go and see your own GP or renew your medication or whatever it may be. You can't request a home visiting GP. We would offer you one if that is the best for that scenario. And what is important in this scenario, and particularly if you're carers, is as well as telling us about your health situation, you must also tell us about your social situation. There's not a specific question in our script that asks, are you a carer? So you need to make us aware of that. So the reason I stress that is you may not be able to leave the person you're caring for alone. Or it might be for the person that you're caring for and they're immobile, they can't get out of the house. Or maybe you've got a young kid, or maybe you don't have access to transport, or you have anxiety traveling at night, or whatever it may be. As well as your medical need, you must tell us your social context as well, because that will help us inform how we're going to support you. And if we tick all those boxes in terms of, yep, you need to see a GP, I want you to see one today, we have one available, for whatever reason you are unable to go leave your house and see a health professional, we will then send one of our GPs to your house and they can treat you there and then. Yeah. If you are calling on behalf of someone, i.e. the person you're caring for, you must be with that person. You must be in the same room as them, because we are going to ask you questions that you need to answer relevant to that, i.e. are they conscious? How is their breathing? Can you touch their skin? What do they feel like? If there is an injury, what type of injury? So you can't be in London and they're in Manchester. If you're calling on behalf of someone, you must be with that person in the room. The second layer that we have to this is our primary care centres. So we call them PCCs, primary care centres. So this is a similar service. So this is also an evening and weekend service. It's similarly a service where you can speak to a GP face to face at that particular time, but this is in a community setting. So this is where we've done all those questions, but actually you can get out, or it will be quicker for you to get out because all our GPs are already on calls and they're not going to get to you for another 4 hours, whatever it may be. This is an additional service where it's evenings and weekends, and you can go to one of our primary care centres. We have one in each borough in Southwest London, and you can see one of our 111 GPs. Again, it won't be your GP, it'll be one of our GPs. So that is when you can physically get out and you can physically go and see a GP. We've got one in each borough in Southwest London. They're in community settings. Most of them are in hospitals. One is in a GP surgery, but most of them are in hospitals. But if we book you an appointment with a 111 GP at a primary care centre, and let's just say it's at Kingston Hospital, yes, you're going to Kingston Hospital, but I'm not sending you to the hospital. I'm sending you to our GP where we rent a room in that hospital, evenings and weekends, and then you can go and see them. And again, that is evenings and weekends only. So that is not a service that we run in the day. When we contact you, we will ask for your consent to access your medical records. When we get that consent, we do not have access to your entire medical history. We only have access to something called a summary care record, which is basically, I like to call it your highlights. So it's your most recent interaction with the health professionals, as well as any long-term conditions that you might have. So it won't be your whole history, it'll be just a snapshot, just so that we can help you in this particular instance. And any work that 111 do with you will similarly be entered onto your GP record. So if we help you Friday and we're like, yeah, this will keep you ticking Saturday, Sunday, but Monday, you got to go see your GP will know that you saw NHS 111 on Friday, what we did for you, and whether or not we issued any medication for you. Yeah. So these are your primary care centres for Southwest London. Like I said, there's one in each borough. You don't have to go to the one in your borough. We will discuss with you whatever might be the best situation. In any interaction you have with 111, you don't have to offer what we're offering you a health service. You can say no. You can say, actually, don't really want someone coming to my house. I'd rather go to A&E. Or actually, yeah, I live in Croydon, but I'm actually visiting my friend in Sutton today, so it'll be closer for me to go to Sutton, whatever it may be. So we will have that dialogue with you, but from your point of view, you must give us as much information and contact as possible, because that way we can then provide you with the best support possible. These are the additional things that 111 do. So my first slide, they're my big ones. They're my big sellers. They're the ones that when I do, people are, okay, wow, I didn't know that. This is all the secondary stuff. So the first thing is GP access. There are a lot of layers to this. One is we can arrange for your GP to call you back. So you might call at 8 o'clock, 9 o'clock, whatever it is. They're all busy. Doctor can't see you today. And from your point of view, that's the end of it. However, if you need to speak to your GP for maybe not booking a medical appointment, but for something else, maybe you need a form signed off, maybe you need something for housing, maybe you need a prescription renewal, whatever it might be. In those instances, we have this thing called a backdoor number where we can contact your GP and say, look, Mrs. Smith, she really needs to speak to her doctor. It's not an appointment. She just needs some clarity on X or Y or Z. In that instance, we can arrange for your GP to call you back. We can book you an appointment with your own GP, but these are very few and far between. So I don't put the big sell on this one. So every catchment of GPs in each area, they have to save a certain amount of appointments for NHS 111 every day, but they're very few. And to give you context, on an average month in Southwest London, we take about 30,000 calls. So although that facility does exist and it does happen, and I have seen us do it successfully, those appointments go like this. So it's not something to hang your hat on, but it is something to know does exist and could potentially help you if you need it. There are two parts to this now, GP callback and video calling. If you've called 111, we've triaged you, and the outcome is we want you to speak to one of our GPs. We can arrange for one of our GPs to call you, and then they can have a consultation with you. And you can do that one of two ways. You can do that traditionally over the phone, but if you have the capability and want to do that, you can also do a video call. The reasons why the video calls are becoming more popular now is if you have a minor ailment, and I always give the example of a rash, you can show us the rash and the GP can give you information straight away. It's like, actually, that's bad, don't go out, or actually, that's nothing. You can carry on about your normal day. You're not contagious and you're not going to make anyone else sick. You know, you can send your grandkid to school, whatever it might be. So there's some benefit to it, but we wouldn't force that upon you. We would offer that. And if you have the option and the ability, then you can use that. Another thing that's become very popular this year is pharmacy. So we're trying to use pharmacies a lot more now. They're very much an untapped resource. So there's two things in and around pharmacy and medication prescriptions in general. One is we can renew prescriptions for you. So if you've got a med and you can't get through to the GP, you forgot to reorder, whatever it might be, you can contact 111 and we can redo that prescription for you and you can pick it up somewhere local to you. We can't do this for a new medication. We can only do this for an existing medication. So if you have a long-term condition that you know about and is on your record and you need meds for, we can renew that for you in those instances. Another situation where I found it to be really useful is if you're traveling. So if you live here and you've traveled somewhere else and you've forgotten your meds at home, you can call 111. And again, if it's a prescribed med that we know about, that's on your record, we can arrange for that, for you to pick that up somewhere near to where you are. And lastly, a good scenario is if you're traveling on holiday. So sometimes people need to have medication all the time. And you need to take a big stash of you to take aboard with you. You might forget it. You might forget to renew it, whatever it may be. Again, in that same instance, you can phone 111. And if it's something that you regularly take, then we can arrange for you to pick that up. And I've seen this happen quite a few times. So it is a useful tool to bear in mind. The other thing is this thing called Pharmacy First. So NHS have been piloting for this for just about a year now. So this is where you can see a pharmacist at a Pharmacy First surgery. Not all pharmacists are Pharmacy First surgeries. There are specific ones. We can send you there, but if you know it's a pharmacy first, you can also go there yourself and what we call self-refer yourself. The benefit of pharmacy first is these are surgeries that have consultation rooms. So you can have an individual consultation with the pharmacist in a private room, not in the main melee as you would normally. And the benefit of this is you might be able to support yourself with that conversation with the pharmacist as opposed to waiting for a longer appointment somewhere else. And pharmacists, what most people don't know is they're trained 1 year more than a nurse and just 1 year less than a doctor. So there's quite a high level of medical skill there to deal with a level of medical complaints. We're not on about, surgeries and all that kind of stuff, but the stuff that your GP would normally be able to advise you on, particularly if it's something that's going to need medication, then pharmacy first can be a good option for you. And if it's pharmacy first, we will book you an appointment and you would go at that scheduled time. But like I said, you can also self-refer to a pharmacy first. But reminder, not all pharmacies are pharmacy first surgeries. I'm going to caveat this a little bit because I have had some horror stories on this one in terms of the patient journey hasn't been the best. So at 111, we have a massive database that connects to all of the GPs and pharmacies and surgeries and all that kind of stuff. We call it a DOS, Directory of Services, which would all the providers that are on there, they need to keep it up to date. So, for example, I've seen examples where we've correctly referred someone to a pharmacy first surgery pharmacy because it was the best option for them and they were happy to do it. But the actual pharmacist that was able to deliver that service wasn't working that day. And they haven't updated their system, so we don't know that. So in that instance, it's a horrible patient journey because the patient's rightly called us, we've rightly triaged and provided a service, but because the pharmacy didn't update their system that day, we didn't know, and then it's a terrible journey because then the patient's getting bounced around, and that drives me absolutely potty. So with these presentations, I try and make them straightforward. Like, I'll tell you everything, whether it's good or bad, and that is one thing where I always caveat in that when it's good, it's good. It works, it's beautiful, the feedback's fantastic, but it's only good if all parts of the system do what we need them to do in that instance. So there are other services that 111 can also refer you to. A&E is the most common one. So that is the conversation we had at the beginning in that actually you're too sick for us. We're going to send you to A&E. So that could be either us redirecting you or it could be us arranging for an ambulance to come and take you. But that will be a pretty quick transition on the call. Another thing, you can't see under there properly, but they're called urgent treatment centers. Anyone familiar with them? Excellent. It's a good set for me then. So we call them urgent treatment centers, UTC. So these are health settings that are open later than GPs. So I like to think of them as like super GPs or like mini hospitals. So they don't have everything a hospital can do, but they do have more than a GP can do. And the benefit is they're open longer. So they're not 24 hours a day like a hospital. They have varying opening times. Some close at 8, some close at 10, some close at 12. But the benefit of an urgent treatment center is if you've come through to 111, again, we've decided that actually this could be a good option for you to get treatment, we can book you an appointment at urgent treatment center. We cannot book you an appointment at A&E. Even if we send you there, even if we're like, yep, Mrs. Smith, you need to go to A&E, I'm sending you an ambulance now, you're still going to A&E and you will be subject to whatever is happening in that A&E at that time. So if someone comes in sicker than you, they will get seen before you. Our service is no different. You know, we're a phone-based service, but if you're waiting for a GP callback and I get 10 more calls that are sicker than you in that time, they are going to get prioritized, just like any other health service would do. So the benefit of urgent treatment center is they are scattered all about the borough. And if we send you there, we can book you an appointment slot. So a slight measure on terms there, we can book you an appointment slot. So if I say go there between 9 and 10, your appointment will definitely be, unless something else has gone completely wrong, between 9 and 10. It won't be at 9 o'clock on the dot. It will be an appointment slot. Yeah. But like I said, you are subject to whatever is happening in that health setting at that time. If you're going to any of our services, whether it's the PCCs, the urgent treatment center, whatever, we will send you a text message that has all that information on there in terms of, right, you're going here, this is the time you're going to be there, and this is where who you're going to see. And in the case of the primary care centers, we will also give you directions to find it, because our hospital environment is a big setting, and we're not, it's not clearly labeled in all of our settings. So we will send you directions on how to get there. So there's last three bits just to talk about in terms of other services. We can refer you to community services. So it might not be that actually you don't need to see a GP. Actually, you don't need to think, I will arrange for the community matron to come to your house, or the guided care nurse, or whatever it is, and they can do whatever service that you need. So just to emphasize that there were a lot of tools in the 111 box. So it's not just phone, triage, hospital, GP. There are other services we can refer to. Dental, we covered this kind of last time when I spoke to the guys here. It's a big issue in Southwest London. So we don't have our own dental services. There are NHS dental services that we can refer you to, but they are very busy. They are very, very busy, and there are lists on those. So, and like any other health service, like I said, you'll be prioritized based on need. Mental health. So this is a fairly new element of our service. So traditionally, we've always taken mental health calls, but we are not mental health specialists. We are not a mental health specialist service. We are more akin to your GP. So we do a little bit of everything. What we implemented over the last 12 months in Southwest London is, if you dial 111, if you feel it's a mental health problem, either for yourself or the person you're caring for, you can select option 2. And option 2 takes you to a specialist mental health provider who can give you specialist mental health support. We are not a specialist mental health service provider. So this is a new service. It's only been running for 12 months, and I'm yet to see any data on how well it's worked in terms of how many calls they've taken and what the outcomes have been. So once I've got that, I'll kind of feed that back to groups that I've spoken to. And the last piece is health information. So this is a common thread that we kind of talked about. People have asked questions about. If you're not sure, call us. We will know. So we will know the latest health information based on whatever is happening. Obviously, when the pandemic happened, calls went through the roof. But you'll remember we've had other instances of, pandemic type illnesses in this country: bird flu, swine flu, foot and mouth. A year or two ago, we had monkeypox. Anytime there's something in the press, social media, we get spikes in calls. Absolutely fine. That's part of our job. We can give you health information, and we can give you the most relevant health information and localized health information. So it's like, could be like, this is an issue, but the outbreak's been in Rotherham. So unless you're going to Rotherham, don't worry about it. Everything in Sutton is all good. If you're not sure about something, call us. If you're not sure if you need medical help, call us, and we can tell you whether or not you do or don't. If you feel you're okay and you want to manage at home, call us. We can give you advice on how you can look after yourself at home. But the general golden rule is, if you are not sure, call us. If we can't help you, we'll send you to someone who can, or we'll be like, actually, you're in completely the wrong place. We're sending you there. But if you're not sure, call us. Okay, so this kind of ties in some of the stuff we've been asked and some of the stuff we've been talking about. This is how 111 works. So when I'm out in community, one of the biggest questions I get is like, why do you ask so many bloody questions? It's like my knees hurting. Why are you asking me if I went on holiday last week, or, if I've got a temperature or whatever it might be? This is why we do it. So the first thing is, that's you in the purple. You're feeling unwell. You decide to contact 111. So like I said, you can do it on the telephone, UK landline, UK mobile, or you can contact us online through the NHS app or through 111 online. Either way, you get the exact same service. you will at some point be talking to one of our health advisors. So health advisors are not clinicians. They're not doctors, nurses, GP, or paramedics. They are regular people that are trained up using our NHS pathways training, which we've been using since 111 began. It's a long course. It's a 6-week course, and only people that pass the course can then become health advisors. And even once they become health advisors, they are literally reviewed every day, every week, every month for the next 6 months until we're fully confident, competent in their abilities to manage calls on their own. When you come through to the health advisor, they're going to ask you lots of questions. And those questions are because we use this national tool that all NHS 111 providers use called NHS Pathways. And with Pathways, the clue is in the name. We ask you lots of questions so we can get down the correct pathway to get you the best support as quickly as we can. When we ask you a question, we then close off a whole bunch of other pathways so we don't have to ask you those questions. So first, we're going to ask you about basics, you know, your name, your number, your calling, all of that. Then we're going to get stuff and like age and gender out the way. We prioritize on age because under 5s and over 65s are more at risk of being unwell, or if something happened, or if that condition being more serious. So like we said, if I send you somewhere and, you know, 10 5-year-olds come in after you, they're going to get seen before you. That's just how the health system works. So age, and the other thing is there are a lot of conditions you can only most likely have if you're an older person, and you're not likely to have if you're a younger person, and vice versa. So first we will ask you those questions, and we will close off all the pathways that we don't need and only focus on the pathways that we do need. Then we will talk about gender. So if you're male, again, there are only certain ailments that you will have if you're male, and conversely female, that closes off another pathway. And then we focus on what we need to focus on. So we basically just keep asking you questions until we reach this stage where we are comfortable that we have understood what your need is. We've reached what we call a disposition that says, okay, this is your options in terms of treatment. And then are you happy with it? So this is literally what our system looks like. So you'll call up and you'll be like, right, age, gender, all that out of the way. What's wrong with you? My head's hurting. Fine. So I don't need to concentrate on pathways for the abdomen or the knee or the foot because we're focusing on the head. Then it's like, what part of the head? Eyes, nose, mouth, ears, the face, throat. We have to drill down the questions, and basically all the health advisors follow a script. So it's an agreed script. And when we first started when my 111 trainers first started delivering training for Pathways, they were on Pathways version 9. Now we're on 47. So we're constantly making it better. Like, we don't need to ask that, or we need to ask that in this way because that gets us a better response. Some of it won't be relevant, some of it will be relevant from your point of view, but from our point of view, it's all relevant because although it's this, it might have a link to that. And we don't know that unless we ask you all the right questions. The questions also have supplementary questions. So for example, one of the questions, if you're bleeding, we'd ask you, how much blood is it? That's an odd thing for people to give in context. So it might be, okay, is it a mug full? Is it a bucket full? Is it a pint full? What color is the blood? Is it dark like coffee? Is it light like, so they have supplementary things to help you, to help us, give us the information that we need. And once we've got through all the questions, we then come to something that we call a disposition. And that is the outcome. What are we going to do for you? And that is based on what we talked about earlier, which is our directory of service. And all of those things in blue are all the things that we discussed. What are we going to do for you? Are we going to send a GP to your house? Am I going to send you to hospital? Am I sending you to pharmacy first? These are the outcomes that we give you. You can say no. You can ask for something else. You can give us more context. This is at the stage where you might not have told us you're a carer. And we'll be like, all right, you need to go there. And you'll be like, actually, I can't go there because I've got to give my husband his meds in an hour, or so-and-so needs feeding, or this dressing needs changing, whatever it might be, give us context. So all of these are options that are there to help you. I'm not saying they're brilliant. I'm not saying they're bad. I'm saying they're options. If you want to go to A&E and sit there for 8 hours, fine. If you feel that you would rather speak to your own GP and are willing to wait for them to call you back next Thursday, also fine. But if you want another option, you have 111. As well as our health advisors, on our team, we have clinical advisors. So these are health professionals. So these are doctors, nurses, paramedics. These guys can advise the health advisors. So it might be a case of, right, I'm talking to Mrs. Smith. I can't really work out what she's getting to. In that instance, the health advisor can be like, right, try X, Y, or Z. Or they can take over the call themselves if they feel actually this is a bit too complicated or there's too much variance there. Let me do it with my clinical hat on, and then they will then take over the call. If at the pathway stage, we decide that, okay, you do need to speak to a GP, but we're all busy at the minute, so a GP will call you back in 2 hours. We will then give you a GP. One of our GPs will call you back. And lastly, like I've said, if we feel it's too serious, then we will arrange for an ambulance to pick you up and take you to hospital. But then remember, you're just going to hospital like anyone else that's walked off the street. It's not a special 111 appointment that you're getting at the hospital. You're just going to the hospital. I'm going to say this about 57 times now. Call us back. So you've called and we said, all right, the GP is going to call you in 2 hours. You called me at 10 o'clock, you had a headache. So my GP is planning to call you back at 12 o'clock based on the fact that you had a headache. Couple of things. One, make sure if it's you, stay awake if you can. If it's with someone else, make sure you're with that person. We will call you back a maximum of 3 times. If you do not answer those 3 calls, we will effectively discharge you from the 111 system. So if you're waiting for a call back, please be ready to receive that call back. 2, I'm basing my callback time on the information that you gave me at 10 o'clock. If at 10 o'clock you had a headache, but then at 10:30 you start feeling dizzy, and at 11:30 you're shortness of breath, I don't know that. No. I know what you told me at 10 o'clock. So if your condition gets worse, call me back. If you feel I'm taking too long to call you back, call me back. If you've got further information to give me, call me back. If you're feeling anxious, call me back. I don't care. Anything that you feel needs addressing, more information, whatever it is, call me back. Yeah, I'd rather take 10 calls than you're sitting there waiting and your condition's getting worse and I don't know any better. If we get really busy, your 12 o'clock callback might go to 2 o'clock. It might go to 6 o'clock. It might never come. If things get worse for you, call us back. In those instances, we do have something called care coordinators. So they are not health professionals. Again, they're regular people, and they will just call you and say, look, Mrs. Smith, you called us at 10, you had a headache. We told you we're going to call you at 12, but the GP is really busy today. So it's probably going to be 2. But has anything changed for you? Okay, fine. If anything changes, let us know. If anything's fine, call us back. Main thing, call us back. My main thing is feedback. Whether we're good or bad, I want to know. Because if we're good, fantastic. I prefer it when I know if we're bad, because that means there's something wrong and potentially I can do something about it. So this is my last bit, literally 20 seconds. These are other ways that you can contact 111. So reminder, it's UK landline, UK mobile, especially if you're expecting a call back. If you're in a different country, we're not going to call you back. If it's a country from a different mobile from a different country, we can't call you back. If you have any kind of issues with visual, hearing, we have a text type facility. So you can text your question and answer to the 111 call handler. Mental health, we talked about. translation services we talked about. I'm specifically talking about 111 in England. So Scotland and Wales is slightly different. But other than that, I'm done. Thank you for your time.